If you're over 60 and listening to this right now, I need you to know something that could literally save your life in the next 5 minutes, 5 days, or 5 years. My name is Dr. Michael Harrison, and after 4 decades as a cardiologist, I've seen thousands of heart attack patients walk through our emergency room doors. But the ones who haunt me aren't the ones we saved. They're the ones who never made it to us at all. Last month, I lost a dear friend, Martha, who was 68 years old. She was gardening alone in her backyard when she felt what she described to her neighbor later as just feeling tired and a little sick to her stomach. She went inside, took a nap, and never woke up. Martha died of a massive heart attack alone because she didn't recognize the warning signs that her 68-year-old body was screaming at her. Here's what breaks my heart about Martha's story and why I'm recording this message for you today. She could have survived. In fact, she should have survived, because I'm going to share with you the exact 7 steps that have helped dozens of my patients over 60 not just survive heart attacks when they were alone, but thrive afterward. If you're between 50 and 80 years old, if you live alone sometimes, if you have high blood pressure, diabetes, or if heart disease runs in your family, these next 30 minutes could be the most important half hour of your life. Let me tell you why I'm uniquely qualified to share this with you. 42 years ago, I walked into my first cardiology rotation as a young resident, thinking I knew everything about heart attacks. Boy, was I wrong. My very first patient was a 74-year-old gentleman named Richard, and I'll tell you his incredible survival story in just a few minutes. But that encounter changed everything I thought I knew about heart attacks in older adults. You see, everything I'd learned in medical school was based on how heart attacks present in younger people, particularly men in their 40s and 50s. But seniors are different. Your bodies are different. Your symptoms are different. And unfortunately, the way many of us in the medical field were trained to recognize and treat heart attacks was leaving too many seniors like you behind. Over the past 4 decades, I've dedicated my career to understanding exactly how heart disease affects people over 60. I've published research, trained other doctors, and most importantly, I've sat bedside with thousands of patients and their families. I've seen miracles, I've witnessed heartbreak, and I've learned that when it comes to surviving a heart attack alone, knowledge truly is the difference between life and death. But here's what I've discovered that most people don't know. Age is not a death sentence when it comes to heart attacks. In fact, some of my most inspiring survival stories come from patients in their 70s and 80s who knew exactly what to do when their hearts were in crisis. Now, before we dive into those 7 life-saving steps, I need to share some hard truths with you about heart attacks and aging. First, if you're over 60, your risk of having a heart attack increases significantly. But more importantly, your symptoms might be completely different from what you see in movies or what happened to your younger neighbors. Hollywood has done us a terrible disservice. You know the scene. A middle-aged man suddenly grabs his chest, grimaces in pain, and collapses dramatically. That's not how heart attacks typically present in seniors, especially women over 60. In my experience, I'd say about 60% of my senior patients never experience that classic crushing chest pain. Let me paint you a more accurate picture. Mary, one of my patients who was 71 when she had her first heart attack, described it to me like this. "Doctor, I just thought I was getting old. I felt tired all the time. I couldn't catch my breath walking up my stairs, and I kept waking up in the middle of the night feeling anxious and sweaty. I thought it was just part of getting older." Mary's experience is typical. For seniors, especially women, heart attack symptoms can be sneaky. They creep up on you over days or even weeks. You might feel unusually tired, like you haven't slept well in days. You might have trouble breathing, not just during exertion, but even while resting. You might break out in a cold sweat for no apparent reason, feel dizzy or lightheaded, or experience nausea that won't go away. Some of my senior patients have told me they felt pain in their back, neck, jaw, or arm, never in their chest. Others described it as feeling like the worst heartburn they'd ever experienced. And sleep disturbances? Almost universal among my senior patients who've had heart attacks. Here's why this matters so much. The average person experiencing these symptoms waits over 2 hours before seeking help. For seniors, that number jumps to nearly 4 hours. And here's the devastating truth. For every minute that passes during a heart attack without treatment, you lose heart muscle that you'll never get back. But I have good news. Every single one of the patients I just mentioned, Mary, Martha before her tragic passing, Richard, and dozens of others, could have dramatically improved their outcomes if they'd known and followed the 7 steps I'm about to share with you. Step 1. Recognizing the warning signs. Let's start with step 1, which is absolutely critical, recognizing the unique warning signs of a heart attack in seniors. I've learned this the hard way through years of seeing patients who dismiss their symptoms as just getting old. I remember Eleanor, 78 years old, who came to see me for a routine checkup. During our conversation, she mentioned that for the past 3 weeks she'd been feeling off. She couldn't put her finger on it, but she was exhausted, had trouble sleeping, and kept feeling like she needed to take deep breaths. Her daughter had insisted she come in, even though Eleanor felt like she was wasting my time. Thank goodness for daughters who pay attention, because Eleanor's EKG showed clear evidence of a recent heart attack. She'd been having one, on and off, for weeks, and had no idea. So let me be crystal clear about what to watch for if you're over 60. First, unusual fatigue that doesn't get better with rest. I'm not talking about being tired after a busy day. I'm talking about exhaustion that feels different from anything you've experienced before. One patient described it as feeling like someone pulled the plug on my energy. Second, shortness of breath that's new or different for you. Maybe you've always been able to walk up your stairs without thinking about it, but suddenly you're huffing and puffing. Or maybe you find yourself short of breath even when you're sitting still. Third, cold sweats, especially if they come with other symptoms. These aren't hot flashes or normal perspiration. They're clammy, uncomfortable sweats that seem to come out of nowhere. Fourth, nausea, vomiting, or what feels like severe indigestion. Many of my senior patients, especially women, describe feeling like they have the flu or food poisoning during a heart attack. Fifth, dizziness, lightheadedness, or feeling like you might faint. Your heart isn't pumping effectively, so your brain isn't getting enough oxygen-rich blood. And finally, pain or discomfort that might not be in your chest at all. I've had patients describe pain in their back, neck, jaw, shoulder, or arm. One gentleman told me it felt like someone was squeezing his throat. Here's the key. Trust your body. You know yourself better than anyone. If something feels different, if you have that nagging feeling that something isn't right, don't dismiss it. Don't wait to see if it gets better. Your life could depend on taking action immediately. Step 2, call 911 immediately. Now, step 2 seems obvious, but you'd be amazed how many people get this wrong. Call 911 immediately. Don't call your doctor. Don't call your adult children first. Don't try to drive yourself to the hospital. Call 911. Let me tell you why this is so crucial, especially for seniors. Robert, 69 years old, was home alone when he started experiencing chest pressure and shortness of breath. His first instinct was to call his son, who lived 20 minutes away. Then they debated whether to drive to the hospital or call an ambulance. By the time Robert reached our emergency room, nearly 90 minutes after his symptoms started, he'd suffered significant heart damage that could have been prevented. Compare that to Patricia, 73, who was home alone when she felt that sudden, overwhelming fatigue and nausea I described earlier. She immediately called 911. The paramedics were at her door within 8 minutes, started treatment in her living room, and had her in our cardiac catheterization lab within 45 minutes of her first symptom. Patricia's heart damage was minimal, and she made a full recovery. Here's what happens when you call 911 that doesn't happen when someone drives you to the hospital. First, emergency medical technicians can start life-saving treatment immediately. In your home, in the ambulance, on the way to the hospital, they have medications and equipment that can buy your heart precious time. Second, when an ambulance arrives at the hospital with a heart attack patient, it triggers what we call the cardiac alert system. This means that by the time you're wheeled through our doors, the entire cardiac team is ready and waiting. We can have you in the cardiac catheterization lab, where we can actually open up your blocked artery within minutes of your arrival. Third, if something goes wrong during transport, if your heart stops, if you lose consciousness, paramedics are trained to handle these emergencies. They have defibrillators, they know CPR, and they're in direct communication with emergency physicians who can guide their treatment. When family members drive heart attack patients to the hospital, I've seen too many tragic outcomes. Cars don't have medical equipment. Family members, no matter how well-intentioned, aren't trained to handle cardiac emergencies. And every minute counts when your heart muscle is dying. So please remember this. The first number you dial when you suspect a heart attack should always be 911. Step 3. The aspirin protocol. Step 3 is something you can do immediately while you're waiting for help to arrive, and it could save your life. Take aspirin, but only if you're not allergic, and only after you've called 911. I learned about the power of aspirin from my colleague Dr. Susan Martinez, who shared a case that still gives me chills. Her patient James was 76 and home alone when he began experiencing what he described as pressure in my chest like an elephant sitting on me. James called 911 first. Good man. But then he remembered something his previous doctor had told him about aspirin during heart attacks. James chewed 4 baby aspirin. That's about 325 milligrams total, while he waited for the ambulance. When he arrived at the hospital, his EKG showed a heart attack in progress, but the damage was significantly less than we would have expected. The aspirin had prevented his blood clot from getting worse, essentially buying his heart muscle time until we could get him to the catheterization lab. Here's why aspirin works during a heart attack. Most heart attacks are caused by a blood clot that forms in one of your coronary arteries, cutting off blood flow to part of your heart muscle. Aspirin helps prevent that clot from getting bigger and can sometimes even help break it up slightly. But here's the critical part, and I cannot stress this enough. You must chew the aspirin. Don't just swallow it whole. When you chew aspirin, it gets absorbed through your mouth and into your bloodstream much faster. We're talking minutes versus half an hour or more if you just swallow it. The dose matters too. If you have regular strength aspirin, that's 325 milligrams, chew 1 tablet. If you only have baby aspirin, that's 81 milligrams each, chew 4 tablets. The goal is to get 325 milligrams of aspirin into your system as quickly as possible. Now please listen carefully. Only take aspirin if you're not allergic to it, and if you're not on blood thinners like warfarin or Coumadin. If you have any doubt about whether it's safe for you to take aspirin, don't take it. The 911 operator can help guide you through this decision while you're on the phone. I always tell my patients to keep aspirin in multiple locations: your kitchen, your bedroom, your purse or wallet. Because when you're having a heart attack, you don't want to waste precious minutes searching for medication. Step 4. The optimal waiting position. Step 4 is about positioning your body correctly while you wait for help to arrive. And this can make a significant difference in how well your heart functions during a heart attack. I learned this lesson from Margaret, an 82-year-old retired nurse who had a heart attack while visiting her grandchildren. Margaret knew enough to call 911 and take aspirin, but she also knew something that probably saved her life. She positioned herself sitting upright in a chair, leaning slightly forward. When the paramedics arrived, Margaret was conscious, alert, and her blood pressure was stable. She later told me that she remembered from her nursing training that lying flat could make it harder for her heart to pump effectively, especially if she was experiencing heart failure as a complication of her heart attack. Here's what I recommend for positioning while you wait for help. Sit upright or semi-upright at about a 45-degree angle. This position makes it easier for your heart to pump blood and can help you breathe more comfortably. If you feel dizzy or lightheaded, you can lean back a bit, but avoid lying completely flat unless you feel like you're going to faint. Loosen any tight clothing around your neck, chest, or waist. Remove ties, open tight collars, loosen belts. Your body needs all the help it can get to circulate blood effectively. If you're feeling cold or clammy, which is common during a heart attack, Cover yourself with a light blanket, but don't use heating pads or hot water bottles. Your circulation is already compromised, and external heat sources can actually make things worse. Avoid walking around or doing any physical activity. I know the tendency when you're anxious is to pace, but movement increases your heart's demand for oxygen at a time when it's already struggling to get enough blood. If you start feeling nauseous, keep a basin or trash can nearby, and try to stay upright if possible. Vomiting while lying down can be dangerous, especially if you become unconscious. And finally, if you live in a house, unlock your front door if you can do so safely. This allows paramedics to reach you quickly without having to break down doors, but only do this if you don't have to exert yourself significantly. Step 5. The 4-7-8 breathing technique. Step 5 is a technique that I learned from Dr. Andrew Weil, and I've seen it work miracles for heart attack patients who are waiting for help to arrive. It's called the 4-7-8 breathing technique, and it can help reduce the panic and anxiety that often accompany heart attacks, which in turn reduces the workload on your already struggling heart. I'll never forget David, a 71-year-old retired teacher who called me after his heart attack recovery to thank me for teaching him this technique. David said that when he first started experiencing symptoms, shortness of breath, chest pressure, and overwhelming anxiety, he felt like he was spiraling into panic. But then he remembered the 4-7-8 breathing technique we discussed during one of his previous appointments. David told me that within just a few cycles of this breathing pattern, he felt calmer and more in control. More importantly, his symptoms seemed less overwhelming, and he was able to think clearly enough to position himself properly and wait calmly for the paramedics to arrive. Here's how the 4-7-8 technique works. First, exhale completely through your mouth. Then, close your mouth and inhale quietly through your nose for a count of 4. Hold your breath for a count of 7. Then exhale completely through your mouth for a count of 8. That's one cycle. The counting doesn't have to be precise. If you can't hold your breath for the full count, that's okay. The important thing is the rhythm. Inhale for less time than you hold, and exhale for longer than either. So you might do 3-5-6 or 2-4-5, whatever feels comfortable for you. Why does this work? When you're having a heart attack, your body's natural stress response kicks into overdrive. Your heart rate increases, your blood pressure rises, and your heart has to work even harder at a time when it's already in crisis. The 4-7-8 breathing technique activates what's called your parasympathetic nervous system, your body's rest and digest mode. This slower, controlled breathing pattern sends signals to your brain that help reduce the production of stress hormones like adrenaline and cortisol. It can lower your heart rate, reduce your blood pressure, and decrease the oxygen demand on your heart muscle. I've had patients tell me that this breathing technique was the difference between feeling like they were dying and feeling like they could cope until help arrived. One woman, Sarah, aged 69, said it was like having a switch to turn down the volume on her panic. Practice this technique now while you're not in crisis. Count along with me. Breathe in through your nose for 4 counts. 1, 2, 3, 4. Hold for 7. 1, 2, 3, 4, 5, 6, 7. Now exhale through your mouth for 8. 1, 2, 4, 3, 5, 6, 7, 8. Do that 3 more times with me. Perfect. The more you practice this when you're calm, the easier it will be to remember and use when you really need it. Step 6, emergency self-CPR technique. Now, step 6 is something I hope you'll never need to use, but it could save your life in the most dire circumstances. It's called self-CPR, and it's only for situations where you feel like you're about to lose consciousness and help hasn't arrived yet. I need to be very clear about something. This technique is controversial in the medical community, and it's not a substitute for professional medical care. It should only be used as an absolute last resort when you feel like you're about to pass out or your heart is stopping and help is not yet there. The technique involves using your own fist to perform chest compressions on yourself while coughing forcefully. Here's how it works. If you feel like you're about to lose consciousness, make a fist with your right hand and place it on the center of your chest, right over your breastbone. Use your left hand to reinforce the fist and push hard and fast, about 100 times per minute. That's almost twice per second. At the same time, cough as hard and as deep as you can with each compression. The theory is that the combination of chest compressions and forcible coughing can help maintain some blood circulation to your brain and heart until professional help arrives. I learned about this technique from a case study involving a 74-year-old man named Richard. Yes, the same Richard I mentioned earlier, my very first cardiology patient. Richard was home alone when he began experiencing severe chest pain and shortness of breath. He called 911, took aspirin, but then started feeling like he was going to pass out. Richard later told me that something inside him said he needed to keep fighting. He remembered hearing about self-CPR somewhere, so he started pushing on his chest and coughing as hard as he could. When the paramedics found him 12 minutes later, he was conscious and alert. They told me later that based on his EKG changes, they were surprised he was still conscious when they arrived. Now, I must emphasize the risks. This technique can cause rib fractures, especially in seniors whose bones may be more brittle. It's physically exhausting, and if done incorrectly, it could potentially cause more harm than good. This is why it should only be used when you truly feel like you're about to lose consciousness and you're alone. The compressions need to be hard enough to depress your chest at least 2 inches. I know that sounds scary, but if you're at the point where you're considering self-CPR, broken ribs heal, but cardiac arrest without any intervention often doesn't. If you do find yourself in this situation, continue the compressions and coughing until help arrives or until you feel your symptoms improving. Don't stop to rest. The goal is to maintain just enough circulation to keep you conscious until professional help can take over. Again, I pray you'll never need this technique, but knowing it could be the difference between life and death in the most extreme circumstances. Step 7. Emergency Preparedness Plan. Step 7 is perhaps the most important of all because it's what you do before you ever have a heart attack. It's creating a comprehensive emergency preparedness plan that could save precious minutes when every second counts. Let me tell you about Helen, an 85-year-old woman who lives alone and is one of my most prepared patients. Helen's preparation saved her life last year when she had a heart attack at 3 a.m. on a Tuesday morning. Helen had followed every recommendation I'm about to share with you. She had a medical information card taped to her refrigerator with all her medications, allergies, and emergency contacts. She had aspirin in her bedside table, her kitchen, and her purse. Her house number was clearly visible from the street with reflective numbers. She had programmed ICE, in case of emergency, contacts in her phone. When Helen woke up with chest pressure and nausea, she didn't waste time wondering what to do. She called 911, told them exactly where the spare key was hidden, took her aspirin, and was positioned properly when the paramedics arrived. From symptom onset to arrival at the hospital was just 47 minutes, well within the golden hour for heart attack treatment. Here's what your emergency preparedness plan should include. First, create a medical information card. This should list all your current medications, including dosages, any allergies you have, your medical conditions, and your emergency contacts. Keep copies on your refrigerator, in your purse or wallet, and give copies to your emergency contacts. Include your preferred hospital if you have one. Second, strategically place aspirin throughout your home. Keep bottles in your bedroom, kitchen, and living room. Make sure family members know where these are located. Check expiration dates every 6 months and replace as needed. Third, make your home emergency accessible. Install reflective house numbers that are visible from the street even at night. Consider keeping a spare key in a lockbox that you can give the code for to 911 operators. Make sure your address is clearly posted and that emergency vehicles can easily access your driveway. Fourth, program your phone properly. Create ICE contacts. These are the people emergency responders will call if you can't communicate. List them as ICE 1, John Smith, ICE 2, Mary Johnson, etc. If you have a medical alert device, make sure it's always charged and that you wear it consistently. Fifth, practice your emergency plan. I know this sounds morbid, but walk through the scenario. Where's your phone? Where's the aspirin? Can you easily reach both from your bedroom, living room, and kitchen? Time yourself. You should be able to call 911 and take aspirin within 2 minutes of deciding you're having a heart attack. Sixth, educate your support network. Make sure your family members, close friends, and neighbors know your medical conditions and medications. If you live in an apartment or senior community, make sure the management office has your emergency information. Finally, consider wearing a medical alert bracelet or necklace. I've seen too many unconscious patients arrive at the hospital with no way for us to know their medical history or allergies. A simple medical alert device can provide crucial information when you can't speak for yourself. I also recommend keeping a go bag ready, a small bag with copies of your insurance cards, a list of medications, and a change of clothes. When you're discharged from the hospital after a heart attack, you'll appreciate having these items readily available. Remember, the goal of all this preparation isn't to make you anxious about having a heart attack. It's to give you confidence that if it does happen, you're ready to give yourself the best possible chance of survival and recovery. Now, let me tell you the complete story of Richard, the 72-year-old patient I mentioned earlier, whose experience illustrates exactly why these 7 steps work so well together. Richard was a retired mechanic, living alone after his wife passed away 2 years earlier. He had high blood pressure and mild diabetes, but he was generally in good health for his age. One Thursday evening, while he was watching television, he began feeling what he described as a heavy feeling in my chest, like someone was sitting on me. At first, Richard thought it might be heartburn from the spicy dinner he'd eaten earlier. But then he started feeling short of breath and began sweating, even though his house wasn't warm. That's when Richard remembered our conversation from his last appointment about heart attack symptoms in seniors. Here's what Richard did right. First, he recognized that his symptoms, chest pressure, and he didn't try to drive himself to the hospital. Third, while he was on the phone with the 911 operator, Richard chewed 4 baby aspirin from the bottle he kept in his living room end table. Fourth, he positioned himself sitting upright in his recliner chair and loosened his shirt collar and belt. Fifth, Richard used the 4-7-8 breathing technique we had practiced during his office visits. He told me later that this helped him stay calm and think clearly instead of panicking. When he started feeling like he might pass out, about 10 minutes after calling 911, Richard began the self-CPR technique, coughing hard and pushing on his chest until the paramedics arrived. Finally, Richard's emergency preparedness paid off. His house numbers were clearly visible. He had given the 911 operator the location of his spare key, and his medical information card was right on his refrigerator, where the paramedics could find it immediately. When Richard arrived at our hospital 52 minutes after his symptoms began, we were able to get him into the cardiac catheterization lab within 15 minutes. We found a complete blockage in his left anterior descending artery, what we call the widowmaker, and were able to open it with a stent. Because Richard acted so quickly and correctly, his heart damage was minimal. He spent only 2 days in the hospital and made a complete recovery. 6 months later, he was back to working in his garden and even took a trip to visit his grandchildren. Richard's story illustrates perfectly why these 7 steps are so powerful when used together. Any one of them alone might not have been enough, but together they gave him the best possible chance of survival and recovery. As I wrap up our time together today, I want you to remember that knowledge is power, but only if you act on it. Everything I've shared with you, from recognizing those subtle symptoms to creating an emergency preparedness plan, only works if you take action now while you're healthy and thinking clearly. I've been practicing cardiology for over 4 decades, and I've seen too many preventable tragedies. I've also seen miraculous recoveries from patients who knew exactly what to do when their hearts were in crisis. The difference between these outcomes often comes down to preparation and quick, appropriate action. Take some time this week to implement Step 7. Create your emergency preparedness plan. Make sure you have aspirin easily accessible. Practice the 4-7-8 breathing technique. Talk to your family about your medical history and what they should do in an emergency. But most importantly, trust yourself. You know your body better than anyone. If something feels different, if you have that nagging feeling that something isn't right, don't dismiss it as just getting older. Your instincts could save your life. Remember Martha, my friend who died alone in her garden? She ignored her body's warning signs because she thought they were normal for her age. Don't be Martha. Be Richard. Be Helen. Be prepared, be aware, and be ready to act if your heart needs help. Heart attacks don't have to be death sentences, even if you're over 60 and even if you're alone. With the right knowledge, preparation, and quick action, you can not just survive a heart attack, you can go on to live a full, healthy life afterward. I hope you never need to use the information I've shared with you today. But if you do, you now have the tools to give yourself the best possible chance of survival. Your heart, your family, and your future self will thank you for being prepared. Take care of yourselves, and remember, every heartbeat is a gift. Make sure you're ready to protect that gift when it needs you most.